Hello, everyone. My name is Maria. I am the chair of the FSET Medical Student Council, and I'm here today with Dr. Thindeel from Orlando Health. So, doctor, if you would like to introduce yourself.
Yeah, my name is Joseph Thundeel. I'm the residency program director at Orlando Health.
So, I just want to get some icebreakers started to kind of get the conversation flowing. So, recently, where has been or your favorite place ever traveled, and why is it your favorite place that you've ever traveled to?
Recently, that's tough. We take big trips every year. I've probably been to maybe between 50 and 60 countries. So I have a strong interest in travel and with that some global health. So I have probably one of my favorite places recently is Mount Kilimanjaro. I hiked up that about 5 years ago, and I have very good memories of reconnecting with some old friends from a a trip that we had planned back in college. So that was great. From a kind of a work experience, I had the opportunity after residency. I worked in New Zealand for about a year. They have a shortage of emergency doctors there. During residency, I did a rotation in Australia, and in medical school, I spent a few months working in South Africa.
Wow, okay. Sounds like you've traveled a lot. I'm very jealous. I want to, after, residency, get some traveling done too. The most recent place I went to was Barcelona this year. So that was amazing. That was my first time like in Europe, and it was really cool to experience that. But yeah, it sounds like you've been to some
Yep,
cool places.
Barcelona's fun also, yeah.
Yeah, no, it was great. My cousin got married in Palma de Mallorca, like one of the islands off of Barcelona. So it was great. It was beautiful, and I really want to go back.
Think
But
that would be even more fun at this point than the big city would be those travels to the islands, the off the beaten path, because it's less crowded and hopefully a little more authentic.
oh, for sure. It's beautiful. It's like all locals and all that stuff. But I guess going back to into your program, can you introduce a little bit about your program and how you guys do things over there?
Yeah, so we have been around for 40 plus years, I think since about 1984. We are a community-based program in Orlando and one of the oldest programs in Florida. And our philosophy has very much been one of resident engagement. You early on as a resident, we recognize that you are going to be our colleague in 3 years. And so our goal is to prepare you to be our colleague and get you engaged in processes to hopefully get your not only your self-confidence clinically strong within the arena of emergency medicine, but also outside of medicine so that you can take on leadership roles as you progress and as you leave residency with the idea of trying to give yourself a lot of diverse options within your career, within leadership, within community service, within research, within advocacy, or whatever it is that you decide is important to you.
It's okay. And then, so I guess going off of that, how would you say the curriculum that you guys offer your residents, how do you balance that with didactics? And then just what are they seeing day to day?
Yeah, so our didactics, we believe in this adult education idea that we do shorter increments and we try to vary it up to meet all sorts of different learner needs. So we mix up, so we do 2 2.5 hour days rather than 1 5 hour day, because you'll realize once you leave medical school and you get into residency, sitting through 5 hours of lecture at one pop is very hard. It may already be hard for you in medical school. It's even harder when you are working a clinic load and you have to go to 5 hours of lecture and then go work a shift for 8 hours or whatever. So we divide it up into 2 2.5 hour days. We mix up some didactic, which is lecture, some hands-on, which might be simulation. We will do interactive case-based conferences, procedure-based conferences. The idea to hopefully vary for different learners how you retain the things that you do. And we also try to do it with spaced repetition so that you'll sometimes get some concepts repeated so that it complements what you're seeing clinically.
Okay, nice. That sounds great. I know that a lot of like adding the little bit of like breaking it up for sure. Cause I don't know about you, but I definitely cannot sit through like 5, 6 hours either.
It's
Um,
like it's a flip switches when you're a third year medical student and you start working clinically that you can't sit. Noon conference is long enough. And so for emergency medicine people, our attention span is such that at 2.5 hours we're done. When we used to do 5 hour conferences, basically the last hour and a half everybody was asleep, and we'd bring in outside lectures and all this, and we realized quickly that the way to approach adults is shorter bursts more frequently.
yeah, for sure. So then I guess going off of like didactics, moving into their day to day, what is the volume and what is the diversity of cases that as residents you'll see in the ER?
So we have a really cool clinical setting. So on the same campus, it's an adult ED. So we see about 100,000 patients a year there. There's the pediatric ED, which is literally just across the street, 50,000. And they're both staffed by us. They're both run by the emergency medicine department. And so on any shift, you will see all walks of life. Because we're a community hospital, and Orlando doesn't have a county hospital, we will see like your uninsured, you will see people who have social determinant of health challenges. You will then see people who are executives at banks, and you'll see people who have sort of Googled everything before they come to the ED. And so you have to kind of, talk to them from the standpoint that they already know a little bit about their disease process. You will see people who have dementia, their end of life care, and we're also the busiest trauma center in Florida. So high volume of trauma, and one of I think the seventh busiest in the country. So we are very busy from all those fronts, both medically, from a trauma standpoint, and on any given shift, you will see all walks of life, multiple different languages. And in certain times of the year, you'll see the Secret Service there because they're patrolling our department, because if an elected official gets injured or hurt or shot, they'll get brought to our department.
Wow, okay. Yeah. I know. I mean, that's one of the things that for me drew me to emergency medicine, the fact that we see everyone from all walks of life and at any given moment, you never know what's going to come in the door.
It is what makes it fun. You can't give up any rotation, right?
Exactly. Yeah. So then I guess what are some of the key highlights in clinical training as you go through residency, starting from like PGY1 all the way to PGY3?
Yeah, good question. So we have very much a graduated autonomy. Your first year, we bring our residents really come from all over the country, and so there can be differences in what they are each good at when they arrive for medical school. And so, we start from square one with each person. You see your own patients, as a first year. And as you get confidence, you start to see more and more on your own. By the time you're a second year, and sometimes you're late first year, the nurses, as they get to know you, will start bringing you into the more critical cases. Hey, can you see my patient? They're unstable. You won't get thrust into situations that you're not comfortable with. And with every single patient you see, an attending will see them with you. And by the time you're a second and third year, you're able to sort of run the department more and more autonomously. And by the time you're a third year, you really are the person seeing the largest volume of sick people, unstable people. And what I have noticed, many, if not most of our graduates actually finish their third year residency and say that third year of residency was one of the best years of my entire life in terms of how much clinical and with that personal growth that they experienced.
Yeah, that's nice that you guys have like the one-on-one, with the attending seeing patients with you because I feel like it allows the resident to get that confidence built, like you're saying, progressively throughout their time. And so I guess going off of that, during the first year, I know you were saying at the end is when, or like even like nurses will start pulling you into those high acuity cases. How does your program ensure that residents are prepared for that high acuity as they move on through it throughout their training?
Yeah, so you don't have to worry that you're going to get thrown into the sickest person in the department as a first year. You may stumble in there, and then we're there to help you. But the way we build to that is, your first year, you get more and more comfortable with, complex decision making, starting with kind of your straightforward patients, your more and more complex patients. And as you get comfortable with that decision making and processes, combine that with our didactic, which will include simulation, where you will, manage unstable, critically ill patients. You'll get a greater sort of understanding and foothold in that by the time you start to see critical patients, like probably, I would say end of your first year and beginning of your second year, the early parts in attending is in there with you. Uh, Early, we kind of help you with the decision-making process. Over time, we step back and let you make the decision making. We'll stand at the foot of the bed, you're at the head of the bed. And then by the time you're third year, we can often stand outside the room and only, respond as you need us. And anytime a resident or someone needs us, we are more than happy to jump in and help. So it is a true graduated autonomy where the further you go, the less help you need, and you let us know. And it's not like we put you on a unicycle and push you and hope you don't fall. We expect that you will have a few falls, and we're there to support you.
Yeah, no, for sure. I mean, it sounds like this autonomy that you guys give people and like the support that you give them as they go throughout residency really is helpful. So I guess going off of that, how would or what do you think your residents would say is the best part of your program, aside from clearly the autonomy that you guys allow
Oh,
them?
I think without a doubt, they would say the program culture. We have a very strong, the nickname our program has had for probably a couple decades is La Familia. Our program director before me was a very nice Italian man, and he named it the family. And that was, and that stuck really. So there's a strong sense, we're a large program, but it feels very close-knit and small. There's a strong sense of camaraderie amongst the residents. They do things socially amongst themselves, also with the faculty. And I think they really like the fact they come to work and they feel like people have their backs with things. We like to do meals together. I'm into food, and so we'll do a handful of things. One of the faculty does a big grill night at his place, and actually two different faculty do that. I will do kind of an ethnic food night at my place, and we try to kind of introduce us all to those different things so we get to know residents also on a personal basis. I think the residents would also say they really enjoy the um the job placement that they get in preparation. The one thing I get year after year are letters from residents who have graduated that have said, I didn't realize how well I would be trained to go out and practice anywhere. So that's something we're very, very happy with.
Yeah, that sounds great. I know that I'm gonna link your website and the Instagram because I know you guys are always posting about, events that you guys do. I was looking on your website and it sounds like the wellness stuff that you guys all do and hang out. I saw they did like a 5K and all this stuff. Like it's really cool. It's a good welcoming environment, it seems like.
Yeah,
And so
and with that, I'll add something. There's talking, this is probably going to be something you ask about. It has to do with wellness.
yep.
And sorry if I jumped the gun. Do you want to ask a question or?
No, go for it. Go
Okay.
for it.
So, so wellness is something, it's not even a word that we really use that much. To me, wellness is something that you integrate into your program. So the way to think about it is wellness isn't just about what you do outside of work. I think that's kind of an important side, enjoying company, having time, for your hobbies and the things that de-stress you. But the really important part of wellness is making sure you work in a work environment at work that's positive. Negative wellness happens when you work in a negative work environment where you dread going to work. You feel like you're overwhelmed. You feel like people don't have your back. You feel like you're not supported, or that you don't have the resources to help the patients that you need. And I would say that part of what we are very, very proud of in our department is this sense that wellness starts with how we approach work. Our faculty love being here. We have a lot of longevity in our faculty. They love coming to work and they love working with residents, and um, really their reason for being is to make this program the best possible program it can be. And I think the same is true. We have a great working relationship with our nurses. I think our hospital is often rated in the sort of top 10% in the country in terms of work environments for healthcare workers. So those are some real big pluses that I think help take wellness, as I see it, to a whole nother level. Part of that is also giving you feedback to help you figure out not only what you're good at, but what you need to work on, and doing it in a positive way so that you can get to where you want to get to by the time you're done. Because as we like to say, residency is not a beat down, it's really a build up. It's for you to get your confidence so that you feel like you can go anywhere in the world. I could drop you anywhere in the world and you could practice at a cutting edge level.
Yeah, for sure. I like that you incorporated, speaking of your day to day at work into wellness because it's true. It's like, we always hear of like the events and all these outside things that we do to promote wellness, but I think, just as important is like you're saying, going to work every day and being excited about it and who you're with, who you're on shift with that day, like, can really make your day.
And that makes a huge difference. That's what I noticed when I was in residency here compared to my friends who did emergency med at other places. They would talk about how much they dreaded work. And I thought, well, it shouldn't be that way, right? I mean, if wellness focuses on just the things we do outside of work, that inherently implies that work is miserable. And I think both can be true. You can have fun at work and you can have fun outside of work. You can have bad days outside of work and you have bad days at work too. So they do not need to be mutually exclusive.
Yeah, for sure. And so I guess a little bit going back into like the curriculum and stuff, how much elective time are you guys, is built into your program? How flexible is it with residents being able to, go into and explore subspecialties within the world of EM.
Like electives, you mean?
Yep,
Yeah.
yep.
Yeah, so we are very flexible with elective time. We offer, for a 3-year program, we do 3 blocks of electives. 1 year, first year, 2, I'm sorry, 1 year, second year, 2 year, third year. And that we that allows a tremendous amount of flexibility. For some people, they use it to pursue subspecialty fellowship training. Let me do a rotation in X, Y, or Z so I can get some experience. Some use it to do research. Some use it to travel internationally. We're very, supportive of global health endeavors. We actually have a couple internal scholarships for people to go travel to specific areas that other faculty are going to. Um, we have an elective that many people go each year, and it's set up in Hawaii. So every year we have about 10 different residents at different times go to Hawaii, usually during their third year or late their second year, and do a rotation there. But we are extremely flexible as long as it's kind of medical based. You can really go do an elective in anything. If you want to do an elective in ophthalmology or plastic surgery, you're also welcome to do that. I think many people try to do things that will help them get to the next step of their career, pursue a potential interest, and also, maybe take a deep breath and, kind of figure out how to enjoy themselves as well.
Yeah, for sure. And so I guess something that a lot of students that are going to be watching this video want to know is what are you looking for in a candidate for your residency program as well as someone that's applying for an away rotation with your program?
Okay, so let me answer the first question. It's a little harder for me to answer because our medical student clerkship director does a lot of that work for who comes and rotates. But what generally speaking, he tries to get a group from when I say diverse regions of the country, so that we kind of continue to have a national draw. We obviously get a lot of people locally, Florida and the Southeast, but also from different parts of the country, so that it's nice to have people from small town rural places integrate with people from bigger cities and kind of learn a little bit from each other. And I think overall having kind of a EM. The other thing he's really looking for is people who are looking to go into emergency medicine. I think that's an important part. The second question, I think, was who succeeds in our program or who will do well.
Yeah.
Yeah. So we're very lucky. We have a lot of talented people who have done, some amazing things like, Navy SEALs, Division I athletes, people who have written books, people who've been in the Olympics, a lot of cool people with cool backgrounds. But ultimately, what really makes someone, I think, very successful is someone who can embrace this idea of teamwork, collaboration, coming to a place, trying to make it a little bit better, having the self-awareness and situational awareness of knowing what you're good at and also knowing what you're not as good at and you need to work on. And what really that means is being open to feedback. There is no way anyone expects you when you start residency or second year or third year in residency to know everything, because I'll give you a secret, you'll never know everything in emergency medicine. And so having that balance of competence with humility, I think, is really that perfect balance, which some people kind of call emotional intelligence, but I think there's a lot more to it to describe it. But ultimately, people who are team oriented and who can get things done, but would get it done with other people.
Yeah, I love to hear that. And so you were saying, like backgrounds to EM and stuff like that, but I know that, as the curriculum is for some medical schools, some people are being introduced to EM a little bit later on in their like experience. So if a student does decide to do EM later, how do you recommend they get their, foot in the door in EM to be a successful applicant?
That is a good question. Now, there are more challenges for people who come from medical schools that don't have emergency medicine. But if you are a late decider, there are always people who decide late. I think it's important to get a rotation, and not just one rotation, multiple rotations in. And the reason why I say multiple is because you might have a good experience somewhere that has a very specific setting that you find compatible, and then you might go to another place and not have as good an experience. But also, the other thing is that enough program directors are wary of people maybe dual applying or, keeping EM as a backup. And I think the way you show that is by doing at least 2 EM rotations to show that, okay, I tried it, I liked it, and I want to do another one, and I'm willing to make that sacrifice.
Yeah, for sure. I know that that's the goal of our council as FSEP Medical Student Council is we want to, show what EM is, and by little things like that you're doing today, like Leading with Us, we're allowed to promote it and show people how great EM is and how great your program is as well. So I guess last thing is, what is one message or big takeaway that you want applicants and students watching this video to know about your program?
We are unique in a lot of ways. Obviously, we've been around for a long time. We have a diverse group of residents that serves a very diverse population in Orlando. I think that's very unique. But I think the biggest thing that stands out to me is the people here love this place, and that includes the faculty, that includes the nurses, that also includes the residents that work here. And kind of with that as a springboard, the one thing I would tell any applicant applying to any field, but I'm going to say emergency medicine because that's what's close to my heart, is do not rely on just a virtual interview for you to get a feel for a place. You're going to find when you do interviews, after you do about 3 virtual interviews, but maybe a little bit more, every place feels the same. Everyone can put their best foot forward. If you really want to understand the culture of a program, meet some of the residents, find an opportunity to come on campus. Either some places do in-person interviews, some do second looks. Make every effort to do that, because residency is unique. It's hard to switch residencies in the midst of it, and you really won't know whether it's the right fit for you until you go and meet some of the people. No place is perfect. You're going to find things you love about certain places and don't like. And can you reconcile the things you like with the things that you don't like? And I think that will be really telling, and you get a better feel for that when you at least set foot on that campus.
Yes, for sure. I love to hear that. Thank you so much. Your program sounds amazing. You guys are also technically in the happiest place on earth because you're near Disney. So, but
Yes.
thank you so much. It was great to speak to you. And if you have nothing else to add to the interview, then we will be ending. All right.
Sure.
Thank you.
Yep. If once